Good day, everyone. Welcome to Partners in Health and Biz. I'm your host, the natural health consultant, Gail Dixon McBride, and I'm so happy that you decided to tune in. So, today, folks, I have a very special guest here with me. Well, you'll see, you can see her. Her name is Theresa Robertson, and I am going to tell you all about my special guest. So, let's begin. Theresa Robertson, she was a dedicated caregiver to her husband for 25 years, drawing on decades of experience as a family caregiver, navigating challenges within the healthcare system, and working while raising a family. And today she is an advocate for caregivers across Maryland. Since 2020, Theresa has served on the Maryland Commission on Caregiving and is currently a member of the National Family Caregiving Champion Collaborative through U.S. Aging. She is also an advocate for AARP and the founder of the Caregiver C.E.O., an organization dedicated to empowering family caregivers to lead with clarity, ask with confidence, and care without losing themselves. With her deep understanding of the dual roles many employees play as workers and family caregivers, Theresa is on a mission to help organizations gain insight and develop supportive policies that boost productivity and retention while addressing the needs of their family caregiving workforce. Theresa is sharing her story to inspire employers, legislators, and communities to support caregivers in meaningful ways so that family caregivers can continue the hard, necessary work of caring for their loved ones. So, without further ado, I'd like to introduce you to Miss Theresa Robertson. So, welcome to Partners in Health, Theresa. How are you?
I'm doing great. It's a wonderful day here in Maryland. We're heading into fall, and I'm excited to be able to share with your listeners about the Caregiver CEO and the important work that the other advocates are doing in Maryland to help all Marylanders who are caregivers.
Absolutely. That's so important. That's so very important. And the reason why I wanted to have you on my podcast, because of the importance, and so many people don't know how to care for their loved ones without burning themselves out. I mean, I'm sure most caregivers are experiencing burnout. So I noticed on your website, Theresa, that you have a seminar coming up on September 13th called Mindset Makeover. And with that said, I just want to ask you, is there a certain mindset that caregivers should develop? And if so, what is the caregiver CEO mindset?
Most people wouldn't be surprised to find that caregiving can be overwhelming. There's a lot of uncertainty, some anxiety, stress, all tied up in caregiving, a lot of negative emotions, guilt. And so, as the caregiver CEO, my mission is to help caregivers own their caregiving life, their caregiving journey, to build some systems to help lift the burden a little bit and maybe try to mitigate some of the uncertainty they might feel. And yes, there is a lot of work that can be done around the thought process, your perspective about what caregiving means and how it is going to shape or change your life. People would be surprised to find that caregivers really are developing some really strong leadership skills. And that's why we came up with the title, The Caregiver CEO, because I would like family caregivers to see themselves as the CEO of their loved one's care, not just a caregiver, but you're doing important work. And that work is transferable to the workplace and vice versa. The work that you do in the workplace is transferable sometimes, those same skills, in your caregiving life. And we'll talk a little bit about what that means.
Okay, wonderful. Yes, because being a person who is possibly a manager or a CEO of their company, there are a lot of responsibilities. There's a lot that needs to be done. But I'm sure most people, like you say, don't think of being a caregiver as also being using the skills that they would need to have as a CEO or manager, but you're going to tell us all about how that's done. So I heard about these systems that you've put in place, and I'm sure maybe that's going to explain all about what that means to actually become or be prepared to handle your loved ones with the mentality of a CEO. So, are there steps or systems that you have created that caregivers need to focus on? And if so, could you tell us about those systems?
Absolutely. Over the last 25 years, as I was caring for my husband, I learned a lot. And I took a step back to consider what are the 7 areas that I think would be most beneficial for caregivers to focus on to help, again, lift the burden just a little bit. And I documented them in my free ebook. It's called the Caregiver CEO Survival Kit, and you can download it by going to caregiverceokit.com. But I will read them for you briefly here. So it's the medical records systems, medication system, appointments system, respite care system, communication, financial and legal, and emergency plan. And so just quickly, I'm going to point out 2 that are that I think are most important that people don't really think about, and that is the emergency plan system and respite care. Because most people don't identify as a family caregiver, I know I didn't for probably the first 10, 15 years. I was just a wife taking care of my husband. I didn't look for information that could help me do my job better. I just tried to trust in God and love my husband. But over time, I learned that there were some things I could do that could make my life a little easier. And let's take a look at the emergency plan system, for example. I heard a story about a woman who was a family caregiver. And one day while she was home taking care of her husband, she herself had a medical emergency and had to call 911. And they determined after looking her over that she was having some cardiac issues. She may have been having a heart attack or something, I'm not sure what, but she needed to go in the ambulance to the emergency room. But she didn't have a plan in place to take care of her loved one. So she hesitated. And that we all know that hesitation can cause you, it can be dire, especially in an emergency. You don't know what can happen. What you want to be able to do is to act quickly. I'm sure if her loved one was sick, she has a plan in place to take care of her loved one while that person is sick. But she herself got sick and she didn't have a plan for someone to come in and take care of her husband or whoever she was caring for. And so a simple emergency plan can be having a conversation with a neighbor or a friend who lives nearby, explaining to them if there's an emergency and I have to go out, be taken by ambulance, or maybe my house catches on fire and I need a place for my loved one to sit for an hour or two. Can you be that person for me? Can I call you? It's just that simple. You may want to have you have more time, have a conversation about what your loved one's needs are, in that situation, because everybody's different. There may be some medical equipment they may need to know how to use, so you might want to show them that. But just having the conversation or thinking it through can create an emergency system that you hopefully will never have to use, but it's there. It's better to have it and not need it than to need it and not have it.
Exactly, exactly.
The
Yes,
other system is respite care. Did you have a question about the emergency system?
No, I was just going to say there, my mother, she's in a facility, assisted living facility, but my sisters and I take turns as caregivers. And many times, well, often there have been a couple of times where there was an emergency in her building. And even before she moved there, she lived by herself. And so she had she lived next door to her neighbor, so she and her neighbor were like best friends. So her neighbor knew that if was anything wrong, she had the phone numbers and my mother's phone number, my mother had hers, and my sisters, we all had each other. We had the neighbor's phone numbers, and she had all of my sisters' phone numbers. So that emergency contact information is very important, and to have that in a place where people can get to it readily, easily, and not have to search for it. So, yes, a lot of people don't have the emergency contacts set in place, and that's very important. You're right.
We had something called File of Life. The File of Life is you can actually create one using a freezer bag. You can buy the kit online, but just take a simple 2-gallon freezer bag and you put in it all the information you would want someone to know in the case of an emergency, and just tape it to the side of your refrigerator. The EMTs know to look there for the information if they have to. So it's a situation where you can't speak or you can't share that information, or you can't go with your loved one. You can just grab that File of Life and hand it to the EMTs as they take your loved one to the hospital, and they will have everything they need or to know about your loved one's condition, medication list, what chronic illnesses they have, who contact information. I used to put my husband's doctor's information, and he went to the hospital so often we would just take the discharge papers and stick them in the File of Life, because it had all that information already in it. And I always included a note that said, "Call me. I'm his wife, and here's my phone number." And they would call as soon as he got to the emergency room. That was especially helpful during COVID.
Mm-hmm.
But the most important thing is to at least think through, what would you do and what do you need in place? And then, when you're ready, take some action to set that system up for yourself. So you don't that's one less thing you have to think about. The other system I wanted to point out today is the respite care system. A lot of people don't realize, because most people don't identify as a family caregiver. They don't know that there are resources available to help them take respite breaks. And it's critically important that you take a break. Whether you are an only child or you feel like you don't have people that can help you, it really is. That's part of owning your caregiving life. It's your responsibility to try to build your tribe. Anybody who's ever come across your path that says, "Let me know if there's anything I can do," get their phone number. Get
Right.
their phone number.
Exactly.
Write it
Okay.
down and
Right.
figure out how they can, even if it's just, can they sit with your loved one for an hour and watch a television show so you can go out and get your hair done or go for a walk in the park. It's critically important to your emotional well-being that you remember what it feels like not to be on or active or on the edge of your seat all the time. You have to get those breaks. It really goes a long way towards helping you to care without losing yourself.
Mm.
Yeah, and there are programs that, I know I'm making it sound like it's easy to build this team, but again, if you were the CEO of a corporation, if you want to grow, you can't do it alone. You need a team. There's a African proverb that says, if you want to go far, what does it say? If you want to go fast, go alone. If you want to go far, take someone with you, or something like that. I hope I'm saying it right. The bottom line is, we can't do this by ourselves.
Right.
And it's okay to ask for help. And I teach caregivers how to ask with confidence, without any expectation. People will say yes if they want to. They will say no, and it doesn't have to mean anything. But you can make the ask, especially if they already gave you the opportunity. They said, "Call me if there's anything I can do."
Right.
So get their
Right.
phone number, and in the kit, there's a chart where you can list the names and numbers of the people and the things they could possibly do for you. And don't hesitate to schedule people to come in. If it's an hour or 2 hour, we had some wonderful friends that would come and sit with my husband and just have sandwiches, and talk about sports for an hour or two. And that little break, it felt good to know that he was having a good time with somebody who cared about him, and I didn't have to worry about him for those an hour or two. Even if I stayed in the house, for that moment, I didn't have to be on duty,
Right. Right.
and that felt good. So
Absolutely.
focus on creating a system that makes sense to you. If you have to hire someone, look in your check your church congregation to see if there are people who are willing to be on your team. Look for volunteers, or there are volunteer networks that you can join, and create a screening process, because you don't know those people. So you want to make sure you screen them, ask for referrals from other people who may know someone. I found someone in my community who was a retired nurse. What a gift that was to me when I
Right.
was caring for my aunt. She lived in my neighborhood. She went to one of the churches I frequent, and she had a nursing background. And she used to come in every night for 2 hours just to help my aunt get dressed for bed and get her tucked in. And I would come in afterwards. So it gave me 2 hours every night to do that.
Right, right.
That for me.
Yeah. I mean, every little bit helps.
Every little bit helps.
Even if you can go out and walk around the neighborhood to get some fresh air and sunshine, while the person is coming to relieve you, whether it be a family member, a neighbor, a church member, every little bit helps. And because some elderly people, a lot of elderly people, they tend to have different, like, okay, for instance, my mother's always cold and I'm always hot. And so, you have to compromise and try to keep the temperature somewhere like in the middle so it's a happy medium. And sometimes you just need to get out and get some fresh air and cool off. So it's nice to have somebody that can come in, like you say, and just give you some respite, and then there are times when you're just exhausted, you're tired. You're doing, everything, washing the clothes, washing the dishes, preparing the meals. Because my sister and I, we were doing all of that, preparing meals, washing clothes, helping my mother get dressed. When she first got out of the hospital, she wasn't able to do anything for herself, basically. So it's very important, like you say, have these systems in place.
And there are respite grant programs available to family caregivers. And often the application process is simple, because there were people who really care about caregivers who are raising funds so that they can give you the money to pay someone to come in. They're not going to give you thousands of dollars, but they'll give you enough money that you can pay someone for a couple of hours intermittently to come into your home and care for your loved one. If you're creative, you may be able to figure out how to get the help you need. And so we have those conversations in the Caregiver CEO Circle program, which we're going to talk about. We're
Mhm.
launching that this fall. I'm going to talk about that at the information session on Friday, September the 12th at 6 p.m. To register, just go to the caregiverceo.com, and we'll talk more about, because the circle is an acronym that means caregivers in real community, lifting each other. I am still getting used to explaining it. Caregivers in real community lifting each other. And you can look at it like a small group program or a support group, but it'll be small groups where they can get to do life together, encourage one another, and I will be available to answer questions. And there'll be others who are former caregivers, who can share from their experience. So I think it'll be a really valuable experience for everyone.
Okay, so these are called the caregiver circles
Yes.
that are formed, and these circles are formed within churches or you help them to form the
So
circles. Or?
we meet virtually, and although I'm not opposed to some starting and meeting in person if that's what they want to do,
Mhm.
and there's no cost at the moment for people to be part of a caregiver circle, and the hope is that they will be everywhere. We have to learn how to lean on each other and help each other. It really starts with first identifying who the caregivers are in your church, who the caregivers are on your job, and then the two or three get together, right? And help to support. And I have a program. So we give you some guidance to help you, shape and sustain or get the most out of that experience. But the idea is that with a little accountability, some support and encouragement, you can not only survive your caregiving life, but you can thrive. I learned so many valuable skills, and caregiving was a gift for me. I would look at other people, even though they may have thought that I would be disappointed, because most of my married life I was a caregiver to my husband, but also most of my married life I treasured every moment. I knew that life was short. I had a gift that other people didn't have. They took so many things for granted, and I didn't take anything for granted. And so when his time came and he went home, I knew that our job here was done, but it was a rewarding experience, even though it was the hardest thing I would ever do in my whole entire life. I don't regret it. I'm grateful that I had the opportunity to love my husband and care for him that way, and then he trusted me. I mean, it doesn't
Wonderful,
get better than that.
wonderful. So is that where the from surviving to thriving, how would you
Right.
how would you explain that surviving to thriving aspect of it?
Because most caregivers are just trying to get through. They're just trying to make it from day to day, and they've really forgotten that they are a person too. And my caregiving life is not just my husband's story because he was the one being cared for. It's my story too. And
Right.
I'm a person with my own unique gifts and dreams and goals. And I held on to that. I can't tell you how important that is. When I was able to go to school and I got my degrees while I was caring for my husband. I started a business. Didn't make a lot of money in the beginning, but I was able to realize my dream of entrepreneurship while I was caring for my husband. I
Right.
didn't move as quickly as some other people were able to move, but I took steps every day to move forward in my life to realize my dreams and my purpose. And that's what it really takes, that type of mindset, not giving up, being your own cheerleader and holding on to your dreams. I want that for everyone. I think that we all deserve that. And because your life might be hard doesn't mean that you don't get to still work toward the things that matter to you. And so that's what it's all about. For a moment, we're going to take some time to talk about what are our dreams? What do you want out of this life? And how do you envision, how do you want your caregiving life to go? It's sad because I heard someone yesterday say online that she resented the person she cared for. She resented him, the whole process, and all she could think of is how she could get out of it. I guess she was thinking how she could save face um, and still free
Still
herself from that
provide.
situation.
Right.
um,
Still provide.
I don't know their life before she became a caregiver. I can just say that's a miserable way to live. I
Yes.
don't want that for anyone.
No.
And I knew I didn't want that to be my story. I saw so many families fall apart, get divorced when their loved one got sick.
Right.
But we were really clear about that. Our marriage was not just about us.
Mm-hmm.
And so we taught our children how to, by our example, how to love even when things are hard. And then when he had to go home, I got to teach them how to say goodbye.
Right.
And that's important. Those are important lessons to learn.
Absolutely. So you are the perfect example of from surviving to thriving because look what God has done and how he gave you the opportunity to help other people and to start the Caregiver CEO and start your own business. And you were doing that, you said you actually started that while your husband was still
Yeah.
sick. You were a caregiver.
I'm
So,
so glad we did too.
pardon me?
I'm so glad I started before he passed away because I had a chance to talk to him about it. I always wanted to honor him and his wishes, right? And so we talked about the fact that I wanted to share our story. And he said, share it with anybody who will listen and anybody who I think I could help. I had his complete support. And I would do podcasts like this and come back and tell him all about it. He was so excited that
Okay.
people were hearing our story. We all want to know that our life mattered, and my husband's life mattered, and it still matters today. That's why I say his name every opportunity that I get, because Emmanuel was a wonderful husband and a good human being.
Wow. Yeah, I see the love on your face. I see how your smile and everything, your face just glows whenever you say his name. So that's just such a blessing to have had such a wonderful marriage and a life with a person that you cared and loved, and the two of you loved each other and shared what true love and caregiving meant with your children. And that's wonderful because your children saw that example. And I'm sure that's also in their lives that's going to show up in how they live their lives now.
I hope
So
so.
that's wonderful.
And I can tell you, I mean, I don't want to give the impression that every day was peachy keen and perfect. It wasn't.
No, no.
But because we did have mutual respect and love for one another, and we had love for God, our faith really helped us to have a see a higher purpose for the work that we were doing. And marriage is a ministry, so there are certain principles involved in our relationship that I don't think everybody has that, but I had that. So
Mm-hmm.
that did help a lot. And we were really clear about what we wanted out of this life. When you get really clear, it's everything gets easier. And that's why I use business principles when I talk to family caregivers, because business owners, most of the work that a CEO does is being really clear about the vision, what they're creating, and then they communicate that vision to their team
Mm-hmm.
and to the world.
Right.
This is who we are, and this is what we're doing, and this is why we're doing it. What is your why? You hear that all the time. What's your why? And so, even as a family caregiver, you need to be clear about those things.
Absolutely. Wow. This has been wonderful. Well, thank you so much for being my special guest and sharing all this information with us. So, before we close out today, could you just go over several of the upcoming events that you have scheduled so people can know where they are, when they are, and how they can attend?
I'm excited to do that. Thank you so much. So Friday, September the 12th at 6 p.m., I'm holding, you can call it a kickoff session or information session at 6 p.m. You can register on my website at thecaregiverceo.com. It's free. Everything I'm doing right now is free. It'll be an opportunity for you to ask me any questions and to learn more about how we can form these circles and the support that I'm going to be lending. Uh, on September the 13th, I'll have Mindset Matters at the Cornerstone Church, 7277 Edenbrook Drive in Columbia, Maryland. And that's at 10:30 a.m. because that's a Saturday morning.
Mhm.
We will get together. I am actually a Lego Serious Play certified. So I'm going to bring some Lego bricks. Don't be surprised. We're going to do some things with Legos. And but we're going to have a conversation. And when you leave, my hope is that you will to again have a clearer understanding, a better perspective around your caregiving life, and maybe learn some things that you didn't know before to make it a little easier.
Wonderful, wonderful. Well, I plan to be there, so you can definitely count me in, look for me, and I'll be right up front taking notes.
Oh, wonderful.
So, yes, so any final thoughts as we close out this segment of Partners in Health and Biz? Overall, any final thoughts that you'd like to share?
Yes, you can find most of the information on my website at thecaregiverceo.com. And I hope to see you at one of those events because I really like to get to hear from family caregivers some of the things that are on their heart. It may shape the direction that we go with this ministry or this business. I may change some things because if I, based on the feedback that I get from others, and we're just getting started. The advocacy work that we do with the Maryland Commission and AARP, that's important too. We'll be going into organizations within Howard County to encourage them to create caregiver friendly workspaces. So I definitely need to hear from working family caregivers about what would help them to be able to maintain their employment if that's their desire and also care for their loved ones. So we have a lot of conversations there are a lot of conversations that need to happen. So I'm excited about what we're going to do this year.
Absolutely. Okay. So again, thank you so much for sharing and being my special guest. So you've been listening to Ms. Theresa Robertson and her organization, the Caregiver CEO.